And the Indiana Black Legislative Caucus is shining a light on the disproportionate impact this virus seems to be having on African Americans in our state and beyond. This week, Kayla Sullivan spoke with members of the caucus and with former state health commissioner and candidate for governor Woody Myers.
Indiana's black population is roughly 10%. The latest statistics show nearly 18% of COVID-19 Hoosier patients are African American. The percentage of black people dying from the disease in Indiana is 20.9.
There are many reasons attributing to these numbers, including but not limited to a lack of quality health care access, a lack of health insurance, prior chronic health conditions.
The caucus also listed other factors like systematic racism, poverty, food and pharmacy deserts, lack of transportation to testing, and a greater chance of a black person being an essential worker at this time.
We have laid out 8 recommendations, and we're starting with a health disparity task force.
Some of the other recommendations include testing and triage centers placed in black neighborhoods, resources to purchase medication, and more racial data on all major chronic illnesses.
We've already had health disparities before with these chronic illnesses, but now in a time that we are in a severe health crisis, I think the government will be more apt to say, okay, maybe we do need more funding for these public health. Maybe we do need to start collecting racial data at all times.
The current COVID-19 racial data in Indiana isn't exact. 19.2% of COVID-19 cases are marked as an unknown race.
This is real data, this is real life, and we can't continue to go down that road with blinders on each side of our eyes that these issues are not important to our communities.
Former state health commissioner and Democratic candidate for Indiana Governor Dr. Woody Myers says other states are doing better addressing this problem.
Illinois, New York, California are the ones I look to as leaders and those that have approached this more directly.
There's no exact cost estimate for these suggestions. The IBLC says similar proposals were denied in the past, but there's a better chance now.
These are abnormal times.
From the Indiana State House, I'm Kayla Sullivan.
Also this week, state election officials finalizing plans for the state's primary now pushed back to June, with details now in place for some in-person voting and expanded absentee voting. The Election Commission met virtually Friday. Earlier this week, I spoke with both state party chairmen.
So anyone who wants to across the state can vote by absentee mail ballot at this point in time. Really looking now at, the in-person early voting and in-person voting on election day. I think, there is just a real desire from a lot of folks that we've been hearing from to be able to have an in-person option. This is, in my view, one of the ultimate essential services. The cornerstone of our democracy is to be able to cast your ballot.
You guys made the difficult decision this week to cancel your state party convention. Walk us through that decision and the implications of that here in an election year.
Well, we didn't cancel it as much as we just moved formats. So we are required to have a state convention under state law. And so we made the decision, which I will agree is it may be a little difficult to move the format to a virtual one. We have met in person. I don't think there's ever been a virtual convention for the state Democratic Party, but that's how we're going to do it this year.
All right, Republicans also considering a virtual option. No decision yet. Coming up next this Sunday in Focus, what are Hoosier voters saying about the president and governor's response to this crisis? We'll be back right after this.